Hi, my name is Marcine Smith. I'm a nurse, just retired after 47 years of nursing about 2 years ago. I developed a condition with my left hip 2 years ago, started having a lot of pain. So I made an appointment with Dr. Ameglio, saw him, and he did an x-ray and diagnosed me as hip dysplasia. So a year went by and I started having severe pain in my right hip. And it was very similar to the pain I had in my left hip. So I immediately saw Dr. Ameglio. He did an MRI and some x-rays and he said, "You are bone on bone. You have severe arthritis from so many years of activity and being a nurse and lifting and everything I do." He said, "So we're going to have to do the procedure." And I went in for my 10-day checkup, and about 3 or 4 days after surgery, and I'm walking, I'm bearing weight, I noticed that I had pain in my SI joint. Actually, it was in my buttock area. I wasn't really sure what it was. Went in to see Dr. Ameglio and I said, "You know, I'm not a complainer, but I am really having a lot of pain right in my right buttock area." He's such a good doctor that he doesn't jump to procedures or let's do this or this and this. He said, "Let's watch it for a while, Marcine, and see what happens." So over the course of the next 2 months, I had pain every day. I had stabbing pains down into my leg, and I thought, something has to be wrong. He said, "I think it might be your SI joint." And I'm thinking, what would that have to do with my hip? I went, back in to see him again, and I said, something's wrong. So he said, "Well, let's do a trial injection with cortisone into that SI joint." I said, "Well, at this point, I'm willing to do anything." And he said, "If it is successful, it's going to be our diagnosis." He said, "Because this is how we diagnose the SI joint problem." Well, he did the injection. He took my hand. I stepped down. The pain was gone. Instantly gone. I couldn't believe it. I walked out of the office pain-free for the first time in like 3 months. So that lasted probably 2 weeks or more, and the pain started coming back. So I made another appointment, went in to see him. He said, "Let's do a second injection." And I probably had maybe a day relief from that, and the pain was back. So he said, "It looks to me like we need to do surgery and put an implant into that SI joint to make it more stable." So I scheduled my surgery, outpatient surgery. My incision's about this long. It was amazing. I got up, walked off the table. I had no pain. He said, "No, I don't want you to go home and go rollerblading today or anything." He said, "Just, take it easy for a couple days." So I did. I came home, and honest to God, my pain was gone at that point. So I thought, wow, I would have never thought of this. And I'm online also looking at causes of pain after hip surgery, and it never came up. So he was well aware of looking for it and searching for a solution. I rollerblade 2 or 3 times a week, probably 10 miles a time. I have no pain with that hip whatsoever. I'm back in the nursery. So after I had the procedure, I went back to work. I was able to lift heavy patients. I was able to go back and start rollerblading again, being active, working in my nursery, being happy with my customers, and just getting back to normal. And I feel that this procedure has really changed my life, that I'm able to get back to normal again. And I'm very grateful that I had the iFuse procedure done. It was a miracle.